Hello everyone watching. My name is Christina Patskin and I am a junior on the pre-occupational therapy track. I jumped right away in choosing the topic, Healthcare Disparities for Latino Children Diagnosed with Autism Spectrum Disorder. I hope I caught your attention right away with my first image that says, Autism Speaks. So please listen along to a very important statistic I am going to present to you. The statistic is 1 out of every 68 children are affected with autism, according to the Centers for Disease Control in 2014. There are in fact cultural barriers of unequal access to healthcare that dominate this disorder within Latino children, so this is a very important ethnic group to consider. The reason why we need to consider this ethnic group is that the Latino minority groups encompass the fastest growing population shown by evidence between 2000 to 2010. There is an increase of 43%. Within the Latino minority groups, there are two key barriers that present consequences to delaying ASD diagnosis. The first key barrier is to the left of my infographic, which is perceptions of ASD, which includes lack of information, mental health, and disability stigma. Now, to the right of the infographic, you can see the second barrier, which is parent and family factors that encompass limited English proficiency, lack of awareness of services, lack of empowerment to take advantage of services, and poverty. As a whole, these factors lead to confusion of ASD for the parent and the patient, as well as lack of trust in diagnosis, denial, and normalization. In the following slides, I am going to go into further detail addressing the two main factors and link them to the underlying issue of delaying ASD diagnosis. The first factor examines the theme of perceptions for ASD, which encompasses a decline in access of information for Hispanic minority groups. A great example of this is that there is no awareness of early intervention, developmental disability services, and specialized community resources for children with ASD. Even with the information that is presented to the Latino families about ASD, it is presented in poor quality because the Spanish material is inaccurate information, so parents are very confused about ASD and what the right steps are to take in the treatment measures. Another big concern is stigma, like I said earlier, which plays a huge role in decreasing the early signs of diagnosis for ASD patients. Specifically in the Mexican communities, stigma is on the high rise because the idea of having a child with ASD feels very shameful and embarrassing for the parent. There is another second theme that is very important to recognize, which is parent and family factors. Within this theme, it encompasses limited English proficiency, which is a common problem for Latinos. For instance, scheduling appointments with clinicians and arranging transportation can be difficult. The degree of isolation reaches a very high peak for Latino parents because some of them have issues with their immigration status, so this can reduce services given to the ASD children as well as a decline in financial support. So in their case, the cost of highly specialized services could prevent a family from getting early screenings of ASD, as well as multitude of other factors such as restrictive insurance coverage and transportation of childcare for some patients. In summary, the cultural barriers of stigma, decline of access of information, and limited English proficiency can prevent a child from detecting ASD. So in my opinion, there needs to be some types of methods in which we can lessen the problems of these cultural barriers. Firstly, going off of stigma, I think that there should be community outreaches that are fully inclusive to Hispanic minority groups with ASD. Secondly, going off of decline of access of information, there needs to be more information that is printed accurately to tailor to Latino communities. Lastly, to solve limited English proficiency, I think that there needs to be a greater array of interpreters in the clinic setting. As a whole, if these were all to be in place, I feel that we could possibly seek a resolution to this issue. I hope that after you watch this video, you have a better understanding of the big picture at large, which is the socioeconomic divide, particularly for Latino Americans with autism spectrum disorder. Now I want to leave you with two discussion questions that I would love for you to answer in the discussion post. The first question is, what can be done to bridge the gap of the socioeconomic divide between Hispanic minority groups so that there can be an increasing awareness of early detection of ASD? My second question is, what are some other additional consequences that hinder the access of Latino groups to early prevention of ASD? Now again, please respond to these questions, and I want to thank you so much for watching my video.